So welcome to ComplyPlus Presents. A bit of an unusual setting today. It's me, Louis is not there. I'm here with one of our colleagues, Farai Mabiza. He's a mental health consultant, an expert in this area. So good morning, Farai.
Good morning, Richard.
Yeah.
Thank you for having me here.
No problem at all. We're really pleased to have you here finally. We've been talking about this for a long time.
Mm-hmm.
Yeah. All right, so let's get into it. Like I said, Farai is an expert in mental health, having worked in different healthcare settings, which he's going to be telling us about, but also he's a director at Octrac Consulting. So, Farai, tell us about yourself, a bit of your background, and how you got to work in mental health.
Yeah, thank you. Yeah, so I started working in mental health about 22 years ago. I just took an interest in studying mental health, and obviously that was an opportunity as well at the time. But I began to really enjoy working in mental health, and some of the works I did was in the mental health for the offenders, long-term medium secure unit. Worked in the acute, also then worked in the as a practice development nurse and as a manager as well. So yeah, it's very interesting, and got quite a lot of experience within the NHS, also within the private sector. Yeah.
I know you work. You're probably underselling yourself there and being very humble as usual. But you've worked with the police, with the immigration services. You worked in the emergency departments. Can you tell us a little bit more about how you got to work in those areas, but also what sort of experiences you had in those areas?
Yeah. Now, so when I worked in the acute mental health, I then wanted to find out more about, psychiatric liaison. So this is the department which actually do assessments for patients who come to A&E with mental health problems. That gave me quite a lot of experiences. For example, teaching about mental health to the general, people who work in the general side in the A&E, and also, had opportunity to teach the police as well about mental health. And teach about also doctors. You'll be surprised. Some of the doctors who are working in the general side, they don't really have an understanding of mental
So you're
health.
talking about general hospitals.
General hospitals,
yes.
yes. So we used to support them just to teach them about general mental health awareness. Yeah, and also teaching other other agencies about mental health. So that was quite a lot of experience in that. Yeah.
I remember when I worked in the NHS, unlike you, I went to general settings and I worked in cardiology, but I moved around as well within primary care, secondary care, GP practices, and I do remember those times when whenever we got a patient who came in with mental health problems. Well, no, I should rephrase that actually. Whenever we had patients come in with, say, they come in maybe epilepsy, emergency, or whatever the problem is, then it turns out they have a history of mental health problems.
Yeah.
There was a lot of stigma, and I would probably be in that camp as well where we're worried now that, oh, they've got a mental health problem. What are we going to do with them? So it's almost like, are they going to be a problem?
Yeah.
Do we need to call security? And there was, I know things got better with time, but even as late as 2015, 2016, I remember there were a lot of issues about the number of people who came in, some of them with poor mental health outcomes or problems right at the outset, but some of them mental health would have been a secondary issue. It's part of their medical history. We didn't know what to do with them. And I admit that actually I was one of those people that would have really benefited from someone like you helping us to have a better awareness.
Yeah.
So I don't know, what are your experiences in that area?
Yeah, so it's actually true because even up to now, these things are still happening where people because someone has got a history of mental health, but they're coming to A&E for with a different problem. People are always worried, are they going to be aggressive? Are they going to be, do we need to call, are we actually need to call someone from mental health because it's a mental health patient?
Yeah.
But the issue is they are not coming with that particular problem. Of course, they have got a history, but now they're coming to A&E with something different. So it's that lack of awareness and lack of understanding and the stigma which is attached to mental health. Those are things which we used to then, teach our colleagues in A&E to say, listen, if they are coming for a different problem, which is not mental health, you are treating them for that. If you're worried about their mental health, then let us know. But what you will find is that always, people will always just refer simply because they've got a history or they are known for, for having a mental health problem. So it was just for us to teach our colleagues so that they understand more about mental health, that, you don't necessarily have to assess them for their mental health every time they come to A&E. They're coming for a different problem, just treat that and let's discharge them home. But I think it also just comes with... that was the result of just the stigma attached to that. So our training and our teaching was to do with just getting people to understand that these people can actually live in the community and do other things independently. You don't have to refer them every time they come to A&E to refer them because they've got a history.
Yeah. No, I agree, completely agree, and I can relate to what you're saying there. So, if I can take you a little bit back as well, you did your degree in mental health nursing, then you went on to then do a master's degree. What was this master's degree about?
Okay, so I'll just take you. So basically, when I was working in the mental health in the general wards, I took a keen interest in developing other, the other colleagues, junior staff, students, and things like that. So I then went on to do masters in healthcare education and clinical leadership. That was very interesting because the course involved clinical leadership, which was very important, which I really liked because I spent quite a lot of time at the front line. So clinical leadership became very, necessary and important. Yeah, and also the education side of it as well, where we teach, explore education within health in general.
So practice education.
Yes.
Yeah, rather than universities. And you also did your PG set in education, isn't it?
Yeah. So just to consolidate my my education background and everything else, I then went on to do a postgraduate certificate in education, which obviously helps me to explore more about education in the general, so in healthcare and also even in higher education. Yeah.
So things are going well. You are learning all these things. You are now working in interdisciplinary teams and bridging between mental health services with the police and immigration, with A&E departments. Things are going well. So why start Octrac Consulting? What triggered that?
Well, as you know, I mean, the statistic tells us that 1 in every 4 people here in UK every year experience mental health problem, and so this number is very high. So the question is, where are these people? Where do they spend most of their time? Obviously, they spend most of their time, at school. Or they spend most of their time at work and things like that. So Octrac Consulting helps organizations to help people with mental health at work. So basically, if people are having mental health and they're at work, then there should be some kind of understanding of mental health. So Octrac Consulting help organizations to deal with mental health, having mental health awareness, and kind of develop policies to do with mental health, and help organizations to accept mental health as something which is there, and we don't have to, to stigmatize and things like that. Which are, there are not a lot of organizations, or even NHS, they cannot help organizations, but it's organizations like small organizations like us who can be able to then help, other organizations to understand more about mental health awareness and things like that. Yeah.
Okay, so what you're saying is, if I'm running a business, I've got to think about the mental health of my staff.
Yeah.
And I'm not going to get that help from NHS organizations. There needs to be organizations in between, people like yourselves who are experienced practitioners to then come in to help us.
Yeah.
Okay, so what is mental health? Because obviously I know many of us will say, "Oh, I'm a bit depressed today," or we use these terms very loosely. But what actually, from you as a practitioner, as an expert in this area, what is mental health?
Well, so basically, mental health so everyone has got mental health, just like any physical health. So basically, it encompasses our emotional, our psychological, and our social well-being, so that we are able then to function in the community and also contribute or participate in the community. It also affects the way we think, act, and feel, and how we deal with stress. Yeah. So if we have good mental health, then we are able then to deal with daily stressors and go on with life. But when we now have poor mental health, it then becomes difficult for us to deal with daily stressors, and sometimes then we need some kind of help. Yeah.
Okay, so what is the impact then on a person? Like you're saying earlier that we're spending. I know you worked with students as well. By the way, you were working with the universities as well. So if I'm at university or if I'm at work, what would be the impact of poor mental health? I know you said 1 in 4 would experience a mental health problem, and 1 in 6 who have who reported experience one of the common ones.
Yeah.
Yeah. So what is the impact on a person's life, including work or university?
Well, so I think there's also I did mention about stress. So so in terms of mental health, it encompasses our emotional, our psychological, and our social well-being, and it also affects the way we deal with stress and things like that. Now, so the impact it has on our daily life is that sometimes when we now have poor mental health, we find it difficult to deal with daily or other things. Like, for example, if you are a student at university, you may find it very difficult to cope with assignments and workload and that kind of thing. Same as well, if you are someone who is working and you're experiencing poor mental health, you start experiencing difficulties in productivity and things which you ordinarily you'll be able to deal with. So it affects then productivity and the way we do our work. So obviously it will impact on what we do every day, even when we're at work as well.
So one thing, I think even you and I have discussed this before. We mentioned these statistics: 1 in 4 who experience a mental health problem annually, and 1 in 6 report experiencing one of the common mental health problems. How accurate are these statistics? Because I remember Theresa May, when she was Prime Minister, 2017, I think it was, where she commissioned an impact a project rather to look at the impact of poor mental health. And I think Deloitte came up with some of these numbers, and they were reporting a cost of about £70 billion a year.
Yeah.
That was 2017, 18.
Yeah.
And we're still using and these statistics, I think some of them were showing up as early as 2013, 14. And then we've had Brexit, we've had COVID, and we're dealing with the aftermath. Surely these numbers should change. How accurate are they? How much do we believe them?
Yeah, I think by now this figure should have. I think they have risen to a very alarming numbers, because So some of the causes of mental health are like uncertainties and things like stress and things like losing, loved ones and illness and all that kind of thing. Actually, COVID brought all those things. So I would have thought, these numbers have risen so much. So I think they should be updated because we've experienced all these things. Even right now, we've got all these uncertainties within the conflict in the world and things like that. All this brings a lot of other anxieties and other problems as well associated with mental health. So I think the numbers should be much, much, much more than that.
I agree with you because, as you know, I'm an avid follower of politics, history. You look at the news, and we have to do that for our work. It's very every day now. I dread switching the radio on. I still listen to the radio because we have to understand what's going on in the world for our work. It's draining.
Yeah.
So I now have to figure out ways of getting snippets of the news that I'm interested in.
Yeah.
And I risk losing out on things that may be of interest because there's so much turmoil economically right now. We don't know how the world is going to be with the tariffs and geopolitics and all these big man politics going on.
Yeah.
Surely it's going to affect us negatively.
Yeah, definitely. I think it's true. I mean, we used to. I remember when we were working in A&E, we actually used to advise our patients sometimes to limit, to minimize watching TV because I mean it's anxiety provoking when you put on your TV. There's everything is just happening and. A lot of uncertainties because of the news, because of world conflict, because of, it doesn't really help with people who have got anxieties, which is one of the common mental health problem as well. So yeah, I mean it's very difficult, but yeah, it's one of those things where we actually had to advise people to say, sometimes you may need to limit the amount of time you watch TV.
Yeah. Unfortunately, that advice won't work on me. To be fair, actually, I hardly watch the news now, but I do listen to Radio 4 particularly, because I want to know what's going on.
Yeah.
Every day, there's always something like this morning. They were talking about issues in children's services, nurseries, and you think, God, that's a big safeguarding issue, national safeguarding issue where there's abuse of children in these areas, and it's draining actually. But we have to follow the news to understand for our jobs.
Yeah.
So look, these common misconceptions and stigma. When you were doing this work, did you see improvements in practice, whether it's the police, immigration officials, or accident and emergency departments? How was it received?
Well, I think there's still a lot of work which needs to be done because still there is, even years on, there's still quite a lot of stigma attached to mental health. Although there are some improvements, but there is still. I mean, I remember very well when we were working in A&E and police were bringing almost all the people they suspected to have a mental health problem, but. They just needed to understand more about, the fact that although they have got a mental health problem, they can still live in the community. You don't really have to bring everyone who's got a mental health, problem into A&E. There's A&E cannot cope. NHS cannot cope with all these things. So there's a real issue there where there should be a good understanding of mental health and knowing that not everyone should just come to A&E when they've got a mental health problem. Yeah.
So we know that you have poor mental health history of poor mental health. We don't know what to do with you, and you may pose a danger to yourself or the public. So we're assuming all that. So we're going to bring you to A&E. Yeah, that's really sad because it
Yeah.
could be any of us.
Yeah, yeah, definitely. It
Yeah.
could be any of us. I mean, it's anyone can suffer from a mental health problem. That's the reason why we should have a general awareness of the risk factors. For example, if you've got a parent who has got a mental health problem, that you carry that risk factor, doesn't necessarily mean that you are going to have a mental health problem.
Yeah.
But an interplay uh, of these risk factors and other social problems like losing a loved one and all the other things as well, stress, those are the things which can then, increase your risk of mental health problem. So yeah. Yeah. So look,
One of the things, even in general settings, that I found is when people do not understand some of these conditions, then they make assumptions based on uh, based on inadequate knowledge. And then now actually things can spread very fast. Misinformation can spread very fast. So what are the common mental health problems and how do you distinguish between them? For example, anxiety, depression, things like that.
I'll say from a general point of view, I think I'll say start by saying it took me 3 years to qualify as a mental health nurse, which means there's a lot involved in understanding mental health. But in terms of what just said, identifying what's the mental health problem, then you need to have just a general mental health awareness to be able to do that. But um, there are things like people say I'm depressed. We'd always say those.
Yeah.
I'm anxious. We'd always say that. Yeah, but it's a continuum. If when you're depressed, you may just feel things are not going right and things like that. But it's not actually a diagnosis of depression. It's just like you're just experiencing that. And for you to have an actual diagnosis of depression, you need to meet a certain criteria, which the doctor can actually then diagnose you with the depression. So, in terms of awareness, it's just a general understanding to say, okay, if you are finding it difficult maybe to sleep, you are finding it difficult to eat, and you are worried, when your worry is like constantly worried about something, but you may be needing to go and see GP, maybe you may be depressed. When you are feeling anxious without any trigger or anything like that, you may be experiencing some anxiety and things like that. You may just need to speak to someone about that. And um, if you if you're just stressed, every day you are just irritable, you're stressed, you may just be experiencing some form of mental health problems. You may just need to speak to someone. So it's just to have that that general awareness, uh, which which we basically provide as a training for people to understand, to know more.
Yeah. Look, in our sector, healthcare, social care, there are a lot of challenges right now. Regulatory bodies, they've had challenges doing their jobs and they've been found unfit for purpose. NHS England is being scrapped. There's a shortage of staff at every level: doctors, nurses, care workers, GPs. Every area is struggling. And then, if you're running these organizations, you still need to govern them properly. You still need to comply. But how do you do that when staff are burnt out and you're dealing with all these challenges? Maybe from your consulting side of things now, what is Octrac doing to support these sort of organizations, no matter how big or small they are?
Yeah. Um, so, like I said earlier,
Mm,
um, the people we are talking about in the statistics, they are effort. So as you have rightfully said, there's a shortage of staff, maybe there's bed out and things like that. So Octrac Consulting help to organizations to um, look into, let's say, for example, what are absences? What is causing the absences? What do you have the policies to look into mental health? If someone comes with mental health problem, how are you going to deal with that? How are you dealing with stigma of mental health within the workplace? So Octrac Consulting look into the whole workplace. Um, and look at how you are dealing with things, and how we can be able to help you to deal with those things in a better way. And considering that employers, they also have a legal responsibility to look after their own employees, whether they've got mental health problems or not. But if they've got a mental health problem, okay, and what is the legal responsibility for employers? Things like reasonable adjustments. If someone who works for you as an organization is with a mental health problem, yeah, but by law not to discriminate because they've got a mental health problem.
That's the Equality Act.
Equality Act, yes, and you also should be able then to put a plan in place in terms of reasonable adjustment. So the law look at all those things, whether you are doing that as an organization. And so Octrac Consulting help organizations to understand that more and kind of develop mental health policies and procedures so that they are everything within the law.
That's really good. And also, I know that you are a big advocate for proactive mental health practices at an individual level as well.
Yeah,
Can you tell us a little bit more about that?
Well, so basically, this is proactive mental health is about looking into our lifestyles and see how we can be able to promote mental health, so to speak.
Good mental health.
Mental health, yes. Because there are certain things which you can do as individuals. For example, sleeping, having adequate sleep, exercising, and social networking, and all that kind of. They are known to promote mental health. So there are things which you can and do on a day-to-day basis which can actually promote our mental health. So this is what we can also educate or teach organizations to say, look, if you've got people who are working for you, what are approaches you are using to help them to have good mental health and to have resilience, and also to deal with stress in a more constructive way.
What would be the benefits to employers? Because obviously, if I'm worried about the new employment laws, the changes in national insurance, am I going to be able to export to America or whatever? All these problems. If I'm an employer, this seems the least of my problems. Why should employers care?
So employers should care because, let's say, for example, if you've got your people working for you and they have got a mental health problem, obviously it's going to affect productivity. So you want to see how you can be able to help them. There's evidence that, if you invest in mental health, there is a return on investment. Probably for every dollar invested in mental health, there is probably about around $4 or $5 back. So there is that I think there are companies like Deloitte who have already explored those things, and they understand that if you invest in mental health, there is some good return on investment. Yeah, so I think for that reason, all employers should be able to look into investing in mental health.
Makes sense. But also there's a legal requirement, like you say, the Health and Safety at Work Act, there's also the Equality Act. It makes a lot of sense. Okay, Farai, we want to end on a positive note. So from your experience as a practitioner, but also as a business leader, what are the things that you are most proud of?
Okay. As a practitioner, obviously, as a practitioner in the workplace and in the clinical area, I've helped develop, other junior staff and other people I've worked with. Obviously, as a business leader, we have combined with Lenpack to go into some training, and some of the trainings which we do, we look into the staff so that we get them to understand why we are doing what we are doing. it took me a long time, even as a person, to get around the understanding of the requirements for training, the mandatory training. So our training basically is we give to organizations. We look beyond the tick box exercise and look into the staff so that they understand exactly why they are doing the training, their legal requirements, and then also the fact that they can even be prosecuted when if they do things which put the patients at risk. And we also get them to understand why CQC come to visit and do their regulation visit. In my experience, people fear CQC, but our understanding and the way CQC works, that they're just coming to find out whether you are doing what you promised that you are going to be doing. So in our training, we get people to understand that on your day-to-day basis, you should be working in an effective way so that you are actually doing what you're supposed to be doing. You're delivering safe care, and you're not putting patients at risk, and all that kind of thing. So it helps people to understand more, so that on a day-to-day basis, as they go there into clinical practice and work, they actually work according to the CQC regulation, so that when CQC are coming, then they won't get afraid. They won't be afraid, and they won't be anxious about that, because they're actually doing what they're supposed to be doing. Yes.
So, yes, I should have mentioned that we have worked together a lot, isn't it? I think from 2016, we've done quite a lot of projects. So whenever we got clients, whether they are, it's a service for people with addictions or mental health problems, we've always invited you to come and work with us. What I always value and why I enjoy working with you is how positive you are. Because for some of us that lack that in-depth knowledge of mental health, it's quite a challenge to help an organization to turn around effectively, because you have to, yes, we can deal with culture issues, but actually there are things that are very specific to mental health settings, and organizations have to respond in a certain way. But I like the fact also that your focus, and I learned this from you as well, is that compliance is human centered. Because I come from a policy background, and I sort of look at health systems, but obviously health systems involve people. Involve obviously the ways of doing things and the organizations. So you have a way of weaving through that and ensuring that by the time we leave, we're leaving a positive environment. Some of the work that we've done even this year, where we are asked to come in and look at one particular problem, because most of the times people call us when there's a problem, rather than building their organizations to deal and stop with such problems before they even happen. And for me, it's quite daunting sometimes, but you're very calm about it. Is it the experience then speaking there?
Well, I think it's all comes with that as well, experience, and and just knowing that what we are doing is we are working with people, and if they understand themselves that even the regulations we are doing, it's to benefit themselves and other people. I think if everyone understands that, then that does help quite a lot. Yeah.
And isn't it ironic as well that one of the biggest stressors in health and care settings is the Care Quality Commission? People are so scared of the Care Quality Commission that whenever they come in, people panic. I've had business leaders calling me in the middle of the night to say, look, I think CQC are coming, or CQC have come. What do I do? And think, well, we're not going to put out fires when CQC are already there. We need to always be ready. Because, like you say, their role is not just enforcement. Their role is also supportive. And I don't know, maybe it's the way we think differently. I've never feared them. Because obviously, as an organization, if you're running day to day, you should know as a business owner or business leader how things are in the organization. You should, through your own internal systems, audits, and things like that, you should reasonably know whether you're providing good care or outstanding care,
Yeah.
and definitely where care is inadequate, you should know. Otherwise, then the problem is the leadership, isn't it?
Yeah.
Yeah.
You're very right. I think, and you say that you don't fear them because you come from your background. Obviously, is
Governance,
systems,
yeah,
governance,
yeah.
and things like that. So, but I think it goes again to what we were talking about to say that organizations should, in fact, our training, our partnership, we've been looking into, okay, so how can we get people to organizations to look at this mandatory and statutory training as a, as a day-to-day basis where everyone is clear on what they're supposed to be doing and why they're actually doing it. And then when they embed it on their daily practice, then you don't have to be fearing CQC.
Yeah. Look, Farai, we would never have been able to talk about everything. As you know, that you're going to be quite irregular with us here, doing podcasts with us and working with us. I'm really pleased to have you here because I've wanted to talk about these issues for a long time with an expert who knows what they're talking about in this area. So for our listeners and viewers out there, Farai Mabiza, is our partner now, working with us, helping us with the mental health side of the business and supporting organizations that we already work with. But also, he's got his own clients in his own business as well. You can find him at Octrac Consulting. So if you go to his website, octracconsulting.co.uk, isn't it?
Yes.
Yes. But also, he's got a profile on our website on the Mandatory Training Group. We're not competitors, we are partners. So instead of competing, we work together so that we can better support organizations. Farai is also quite active on LinkedIn. He posts regularly, and he's going to be quite regular on ComplyPlus Presents. So Farai, thank you very much for talking to us today. I look forward to having more conversations, and I think a lot of our readers and viewers and listeners will be quite pleased as well that we now have you on board. Thank you.
Oh, thank you very much for having me.
Fantastic.
Thank you.
So see you next week.